Today, I am going to talk about AEDs, automated external defibrillators, demonstration of that, some of the differences in some of the different products that are available now. A little bit higher tech, they do a little more for you. So when you're using an AED, somebody's passed out, unresponsive to you, and you rip off their shirt or cut it off. Turn the machine on.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
To the bare chest. They may have a hairy chest, it's true. The pads would fail to stick
Attach defib pads to patient's bare chest.
properly and they wouldn't deliver the shock to the heart. So they all come as a kit now. Scissors, razors, alcohol wipes, and
Attach
gloves.
defib pads to patient's bare chest.
So I would pull the adhesives off the back. The pictures are on all the pads as to where the placement is going to be.
Attach defib pads to patient's bare chest.
In this particular machine, what's really nice about it, set of pads, is that
Attach defib pads to patient's bare chest.
this piece keeps the two pads from touching, this blue piece here, because like your jumper cables, you wouldn't want them to
Attach
touch.
defib pads to patient's bare chest.
You line up the cross on the nipple line and the nose and peel the backing off, exposing the adhesive right onto their
Attach
chest.
defib pads to patient's bare chest.
All right, the pads are
Don't
on.
touch patient.
If
Analyze.
somebody were doing CPR, they would stop right now.
Don't touch patient. Analyzing. Shock advised.
If they're
Don't
getting a
touch
shock
patient.
or they're not
Press
getting a
flashing
shock,
button.
you're going back to CPR either way. Everybody clear, nobody touching the patient, hit the shock button,
Shock delivered.
boom.
Start CPR.
They jump a little. The CPR compressions begin. This machine is actually smart. It won't start beeping until you're compressing. And then it knows that you may not know the correct speed in order to do proper CPR. It is going to take over and set your speed through its software application, through its metronome. Now we've picked up the pace. It's almost 2 per second. Over 2 inches. You're doing it for 2 minutes at a time. At least 2 inches, using 2 hands. Keep your elbows straight. I can go back and do a lesson on CPR. But this machine is smarter than some of the other products out there. There's a sensor.
Push harder.
If you're not pushing deep enough, it's going to tell you. It paused for the breaths. We never stopped giving breaths. It's optional, but the breaths are still in there. They're very effective. When
Good compression.
you are doing a good compression, it senses that and gives you that coaching and tells you that you're doing a good compression,
Push harder.
and it'll keep prompting you. If you were hard of hearing and could not hear this, you could see the lights lighting up on the machine. So they're like little memes, and each one will tell you which scenario we're on. So this one says, "Are you okay? Call 911. Put the pads on. Hands up, don't shoot. Take your hands off when it's about ready to shock them or analyzing. Hands back on. If they actually needed a shock, it would tell you to push the flashing heart button right here, and this would start flashing when it receives its charge. If no shock is needed or after the shock is applied, you go right back to CPR. So it's lighting up for you. I'm going to shut that down. You would never turn those off. Just leave it on. It's going to stay on the entire time, whether they need a shock or not. It's going to keep coaching you through CPR. The other products on the market, the automated external defibrillators, do not have that coaching ability, but they all do talk to you. They all have that beeping sound on them for you to follow the speed. This one's just a little bit more product, offers some more. And I really like it because this is what the fire departments are using. When they show up on scene, this is the product they have. When they arrive, we may not have remembered how many times the shock's been applied. So it's recording the amount of times that it shocks the patient, how many minutes since you turned it on. If you cannot see, or excuse me, if you cannot hear it, you can see it. There's a gauge right here. And each time you compress on the chest, this is going to hit between the lines there if you're going deep enough. It knows whether you plugged in the kids' pads or the adult pads, and it's going to set the minimum for you. So it's going to go down like this on the gauge. It would be telling you to push harder if you weren't hitting between the lines on the minimum for the child or the adult. And it would be telling you that confirmation, good compressions, if you're doing it properly. Another thing I want to show you about this machine, universal. So when the firemen show up, they can unplug your pads from your machine and plug it into theirs. So that works for them without having to change out pads. And this is something I love too. I encountered these at a swim school and hadn't actually seen this product before. This is the Zoll Plus. And so knowing that we have to keep the airway open, if you are alone and you're not able to open this person's airway while you're giving the compressions, because you're pushing down on the heart to push out blood, but you're also pushing down on the lungs, push air out. Come back up, air comes in, blood comes in, air out, blood out, back in again. At a high rate of speed, instead of just doing this, you're sucking more blood in. And that higher rate of speed, if you get into that window, it'll actually create an effective compression, high quality, that could actually save somebody's life. So the AED, if they need a shock, they're going to need it within the first 2 minutes. I go down, I feel some pain, I pass out. If you wait 3 to 5 minutes for the firemen to get here, and I was in one of the shockable rhythms that this machine detects, and there's only 2 of them, it will not shock me if I go flatline. So if I go down, God forbid, I might have about 2 minutes or less. Once I go down and my heart stops, contrary to the fake news, the TV that tells you flatline, clear, and then they shock the patient, that never happens. We never shock flatline patients. They're called asystole. There is no systolic pressure. The machine sees nothing, says no shock advised, begin CPR if needed. If the heart rate is very fast and chaotic, that's the person that needs the shock. Some of you might be familiar with the term ventricular fibrillation, VFib, or ventricular tachycardia, VTAC. Those 2 rhythms are so fast that the heart is not pumping enough blood. It's just going too fast, recovering too quickly. In the VFib, it's just very chaotic, more of a wiggle than any type of a pump. So that fast recovery and no effective pump means they're going to be done with within 2 minutes. So if I'm waiting for the paramedics to get here with this, it won't be soon enough. I would rather have a machine on scene, get it on them immediately. This particular lid, if I am by myself as one rescuer, while I'm doing the compressions, I can't keep his airway open. So, sorry, I'm going to grab something here. I'll demonstrate with Kyle. Mannequin here. Just do it. The lid is a wedge, so it will open the airway for you. And you saw his head come back. So that manages it, keeps it open while you're doing compressions on him. Now I'm pushing down on his lungs. And I don't have to hold the airway open. I could actually do the compressions with both hands. On a child, you use 1 or 2 hands, but you've got to go over at least 2 inches on them. So this will keep their airway open and keep the spine aligned. He's still on hard, flat surface. So I don't know of any other AED products out there that have that design in their lid wedge shape like that. So just keep that in mind. The Zoll Plus AED automated external defibrillator comes in this bright neon green, convenient handle, carry case. I don't have any stock in this product or anything like that. I'm not a distributor for them. It's just got technology that could really help save a life if you're able to use this particular machine. There are others. Some are smaller, bigger, little. The Phillips Hard Start. This one's the Preston. Most of them still have a 2-pad system. And all the pads show you where they go. This one shows on the side of the body over here, but it's got to be on their bare skin. This one goes up here on their bare skin, and you don't want the 2 pads to touch. Remember, they're like your jumper cables. If they touch each other during the shock, when you deliver it, they're only going to shock to each other, and it's going to avoid the heart. It's not even going to go where it's supposed to. So when I turn on the machine, I pull their shirt up. Maybe they have a hairy chest. The kits that come with the AEDs that are required now have razors, scissors, alcohol wipes, and gloves. So I'll go through some troubleshooting. Hairy chest, it'll fail to deliver a shock, so you might have to shave them. You could rip the hair out. You could hair wax it with maybe the kids' pads if it's an adult. Kind of an expensive hair waxing pad. Just rip it out. Just kidding. The M's and the P's of the AED. I'm looking back at my board real quick. So I like to go over the mistakes and the problems of the AED and tell you the corrections of them. And most of them, everything begins with an M or a P. Move the patient or move the pads. The M's and the P's of the AED, I chose that because it rhymes. My favorite gun is the M&P Shield by Smith & Wesson, my 45. However, this has nothing to do with guns right now. So just to go through these, the M's, no movement, no metal, no moisture, and no medicine patches. The P's are a little more permanently placed. They're implanted under the skin in their chest, the PICCs, the ports, and the pacemakers. If your patient has a pacemaker or other device implanted in their chest, you can't go right over the top of it with your pads here. So if the pacemaker is on this side where your pad goes, you're going to have to rip it off of there and adjust it 1 inch below the device. When they have a pacemaker, it's deliberately left elevated above the chest. So under the skin, but above the chest. So you'd be looking for just a small, round, under the chest bump with a scar right over it. If there's just a flat scar, no lump, you don't have to worry about it. You can go right there. But if there is a lump, they want you to know that's there. So lower the pad 1 inch below, because the pacemaker would block the shock. PICC, sports pacemakers go 1 inch below the device. Let's see what else. Okay. No moisture. The pads, when I place them on the patient and I'm standing in a puddle or on snow and the patient's laying in it, I don't have to worry about that electricity traveling from the pads through their body to the water to me. We used to think that and tell people you had to move the patient if they were laying in a puddle or snow. You actually don't have to do that. Someone must have taken one for the team and it didn't hurt. So you don't have to move the patient delaying their care in that case. However, it's a different story if they're actually submerged underwater. So when they're submerged underwater, you're going to pull the patient out, dry the front of their chest off, and then proceed to put the pads on. They can be wet underneath, just not between the pads. So let's say your patient's sweaty. They're in cardiac arrest. They might be pretty sweaty, cold, clammy skin. You might have just pulled them out of the pool. They were submerged. You're going to have to dry them off between the 2 pads, because if the 2 pads are touching, even if they're not touching, moisture creates that connection, and it's a path of less resistance. If I have moisture on their chest between these 2 pads, instead of shocking down through the heart, it's going across the top like a rock skipping across the top of water, and it just misses the heart entirely. So it would be a waste of time. The patient's not getting compressions, and they're not getting a shock delivered during this time, so waste of time. Make sure the chest is dried off. They can be laying in small puddle. Their back could be wet. It doesn't have to be perfect, but between the pads and where the pads are sticking, you do want those dry so it will stick well. All right, no moisture, no metal. Let's talk about the metal. The metal's very important. The metal devices like their PICCs, the pacemakers, the ports, you're going to go 1 inch below the device with the pad on that side. If you're on the other side of the chest, you don't even have to worry about it. The pad doesn't go over there, and this one would be below it. Once you have metal surfaces, though, think about a factory. up the metal stairs, the metal, I think those are called a mezzanine. So you've got this flat area where if somebody went down, collapsed up there, and we bring the AED up, call 911 and start taking care of the patient on that metal mezzanine, if we deliver a shock when it says to hit the button, boom, this will deliver 200 joules of electricity to our patient, to us, every person standing on that metal. So if you want to make people exit very quickly, hit them with that. So 200 joules of electricity. What's going to happen if you get hit with 200 joules of electricity that you don't need? Better get another AED. I don't think we're going to have enough for everybody that was standing around up there and this guy too. So you might have a problem there. So no metal, no moisture on top of the patient, but it can be a little underneath. No movement. What do I mean by movement? Well, let's say I'm doing my compressions on the patient's chest. That's movement. If the machine starts to analyze like an EKG does, looking at their heart motion, their rhythm, what's going to happen is it's going to see my compressions at the high rate of speed that we apply those now, almost 2 per second. That is simulating one of those 2 shockable rhythms. VTAC, we're pushing right up on it. This machine sees VTAC and it's likely going to say shock advised. Again, that keeps me from doing compressions on the patient that needed it. He's getting a shock that he didn't necessarily need. Complete waste of time. So make sure there's no movement. Also, the ambulance simulates movement. I believe the ambulance simulates the VTAC, the VFib. So VTAC looks like this, like a sawtooth pattern. That's what your hands simulate when you're doing compressions on them. And the ambulance is a kind of real squiggly, wiggly line. And we would see that movement and think that they need a shock. And again, patient care is delayed. Their compressions are delayed, getting a shock that they don't necessarily need. Once you apply the pads, remember, don't take them off. They're staying on there. Even if it says no shock advised, I begin doing CPR right over the top of the center or right between the 2 pads if they don't have that connecting piece. No moisture, no metal, no movement. And the last M is going to be medicine patches. Let's say I cut the guy's shirt off. You got to have the scissors. If they're from Wisconsin, they're probably got hunting clothes on, so you got to cut that off. And by God, he's really hairy. You're going to need to shave the chest. Maybe just rip it out. But I noticed there's a medicine patch on the man's chest. Maybe he's got something right there. Well, if my pad's over here, not a problem. Medicine patch over here, no problem. But let's say this medicine patch is on the same side of the chest that your defibrillator pad is going to be on. I can't go over the top of the medicine patch because first of all, it can burn their skin, but it's going to block the shock. They can have a foil backing and so forth. So that could block the shock to the other pad. Pads don't know where the heart is. They just shock in a straight line through this angle. We put one on the side and one on the front. Boom, right through the heart. The heart happens to be there. So if they have a medicine patch, moving that patch, touching it with my own skin is a danger to me as a rescuer. So I'm going to safely remove it. They are required with these kits now to have scissors, razors, alcohol wipes, and I said gloves. So you'll put the gloves on, you would take the medicine patch off the chest and just move it over to the other side. They're still getting their medicine. I haven't dropped it on the ground for somebody else to touch or pick up. The kids or the pets to get in their mouth, and right away that could be an issue. I don't know what they're wearing in these medicine patches. There's street drugs out there. You don't want to touch fentanyl fingers. That could kill you. You could pass out from it. So safely move those. If you don't have the gloves or somebody else has already used them, I could just use my shirt, the patient's shirt that I removed, just something to protect me from it coming in contact with my skin. It's reapplied on the other side of their chest. They're still getting it. I use the alcohol wipe to clean the medicine off of here and then apply the pad, pull the backing off of it, exposing the adhesive, right? The machine should know or troubleshoot if the pads aren't properly connected, and they're going to say poor pads connection. Once it's analyzing, you'll know it says analyzing, do not touch the patient. Only takes a moment, get ready, because you're going to be doing CPR again. If they need a shock, it'll be right after that. As soon as the body relaxes, the electricity is dissipated, get right back on there. If they get no shock, if it says no shock advised, they're still not breathing, get back on CPR. And let's see, so no metal, no movement, no moisture, no medicine patches. The P's were the picks, the ports, and the pacemakers. Just move those pads. On the other ones, you can move the patient. Like I said, if they were underwater, you've got to get them out, just dry off the front of their chest, dry off the front of their chest so that the two pads are not making a connection from the water. That's going to cover everything. Let's talk about the kids a little bit. So when I open up these machines, if I open up this one, there's usually 2 sets of pads in there. The way they come is wrapped in a wrapper, folded up like this. The wire is out and exposed, and the plug. I could already have it plugged into the machine, but if there's 2 sets of pads, they're going to be the kids' pads, the pediatric or the adult pads. I'm going to choose the pads that I need and rip open the wrapper. It's kind of like a chip package or potato chip package or something. So you rip it open, and then you open it up and you put those pads on. If you have the set of kids' pads, the pediatric pads, use them. If you don't have them, you could use the adult pads on the kids. Not vice versa. You cannot use the kids' pads on the adults because their dose of electricity is much less and it's not going to work on the adults. So they attenuate this dose for the kids down to about 150. The adult's dose of electricity joules is going to be 200. Let's just say, I don't know, for whatever reason, the doctor didn't notice that we were about to hit the shock button. Maybe he didn't realize he was leaning on the patient somehow. If I deliver the shock and I have not cleared the patient, there's a problem for both the doctor and the patient. The doctor now gets joules of electricity that he did not need, possibly sending him into a lethal rhythm. You're going to need an AED for your doctor or whoever the staff is that got shocked. And what you've done is stolen the shock from your patient, so they didn't get enough. His minimum was 200 we start with on adults, so he didn't even get his minimum. Complete waste of time, and we're not giving them compressions either. So that's a problem. We want to make sure these things are going to work without delay. All right. So move the pads 1 inch below if there's a permanently implanted device in there. Fix pacemakers ports. Don't use the kids' pads on the adults. You can hair wax with them, but they're not strong enough for the adults. You can use the adult pads on kids or babies. Again, you've got to remember the most important things. Do not let the 2 pads touch. So I would put 1 pad on the front and 1 pad on the back, on the skin, under the clothing, take the clothing off. But this way, the 2 pads don't know where the heart is, but it's going to shock from 1 pad to the other, and the heart's going to be right in the middle of that. No problem. Okay. And I believe that's going to cover everything. So, and remember, the first thing you do is turn it on and don't turn it off. They will be running to the hospital with these. AEDs do save lives. If you want to see some of the information, you can go on YouTube. You can check out the Zoll Plus. You can go onto their website and check that out. I do want to offer you an improvise. I was an EMT, and seeing the shape, the wedge there, not always do I have somebody else to help me. When I'm doing compressions, the benefit of doing the compression not only is moving the blood for us, but you're moving air in and out of the lungs. 1, 2, 3, 4, 5, 6. But the problem is his airway isn't open. And when you're like this, it's going to cut your airway off. So I need to open his airway. I can improvise with his shirt. I could improvise with a little jacket or rolled up towel. If I don't have that lid is the wedge to do that for me. It doesn't go behind their neck. It's going to go below their shoulders. So as soon as I put it behind his shoulders, I don't know if you can see that very well, but his airway is now open. I'd use a little bit smaller one for a baby, a little bit bigger for an adult. And when you're doing this, it's only going under the shoulders, not under the neck. You don't want it under the neck or the lower third of the sternum, but this upper third of the sternum directly under the shoulders opens that airway for you. So every time I push down, I'm getting high quality CPR compressions, high quality flow of oxygen in there, hopefully a great exchange of oxygen. We still do the breaths. And you know, in another lesson, I'll go over the CPR. It is 30 compressions, 2 breaths times 5. If you are not giving the breast, even though it is a very low risk, you can still do mouth to mouth on the children and the babies, even through COVID. On the adults, we know you're less likely to put your mouth on them, so having a good pocket mask or a face shield. But if you skip the breaths, you would be doing compression only CPR. So instead of 30 compressions, 2 breaths, 5 times, go back to the beginning, check their breathing again. You would do 30 compressions 5 times straight through without stopping until the 5th set. So 28, 29, 30, 1, 2, 3. Each time you get to 30, 28, 29, 30, start back at 1 again. 2, 3, 4, 28, 29, 30. I can keep track of the 5 cycles right on my 5 fingers that are sticking up here. When I get to pinky, I've hit my 5th cycle, go back to the beginning, check his breathing again. Still no breathing, go back to CPR. If the AED is further away, I'm starting CPR and having somebody else bring me the defibrillator. Okay. If you have child set of pads only, don't even bother putting the AED on your adult. Just stick with CPR. It's going to be more effective and better for them because the kids' pads won't deliver enough of a shock. Great. I think that's going to wrap it up for AEDs. Feel free if you have any comments or questions, you could leave those in the section below in the comments section when I upload this video. The American Heart Guidelines are updated every 5 years, so the guidelines that I'm talking about right now on this AED portion were from the 2020 updated guidelines. The speed at which we do our compressions is very important. Not only do we do 30 compressions in 2 breaths, we repeat that 5 times, we do it at a high rate of speed. We've actually lost rescuers to cardiac event on a rescue code for the patient because the speeds that we do this, it's so physically exhausting that we have even lost a rescuer in Illinois back in the 2015-2016 Christmas season, I believe. 2015 was right when we sped up, and we do it at almost 2 per second. Remember back in the day, it was 1 and 2 or 1 1,000. That is too slow. Staying alive didn't work. They were staying dead. I want you to count out loud because as you perform the compression, even though the operator can't see you, if you have your cell phone down on speaker, they can hear you. They have a button, especially around here. This is not guaranteed everywhere, but my county, they have a button and they're tapping it. And as you're counting, they tap the button and they can interpret your speed first couple of taps. So they're able to tell you, you know, they can't see your depth, but they can say it's over 2 inches if you've got an adult there, at least maybe even up to 2.4 inches on a larger adult. But let me hear you count. 1, 2, 3. That's a good speed right there. And that operator is going to coach you. That was the biggest thing in our 2020 updated guidelines. We didn't actually update too much. We found the perfect speed, the perfect depth, the perfect location, but we're not good enough. So they've incorporated a coaching role for us now. So when we're running the code, we're coaching each other. Nobody is as good as when they started out. We need to be coached in order to get to that high quality compression. And this is outside of the AED, but I want to explain this. High quality compression means I'm going fast enough, deep enough in the proper location that I'm actually sucking more blood in and more air into the lungs and getting that done properly. We're doing this at, when I say almost 2 per second, it is 100 to 120 per minute, doing it for 2 minutes at a time. So it's just about as fast as you can get a compression done. 28, 29, 30. That operator can say to you, hey, I need you to speed up. Remember, it's over 2 inches deep on the adult. It's at least 2 inches on the kid. But the babies, they're 1.5 inches. I like to think of infant and a half, 1.5 inches. But these two are very similar. Adults and kids are at least 2 inches. It's more than 1/3 the depth of their chest. I'm not giving him a heartbeat. I have to squish his body enough to push all the blood out of his heart and the muscle air out of his lungs each time I do that. It's significant. On the adult, you're going to break bones, especially if they're 65 and older. Kids, they're more flexible. The babies, their bones are going to bend. It's non-life-threatening injuries, even if you break them on the adults. So when in doubt, I need to dig deep. Because if you're not doing it deep enough and fast enough, I'm not doing it. So if, like I said, you have any questions, if you like the video, you like the content, you like how I simplify things, I love the Second Amendment, I love everything two hands, 2 minutes, 2 inches. I teach 2 main things, CPR and firearms. So I relate a lot of that together. In future videos that I'm going to offer, if you want to hear about a particular lesson, let me know. I'll go over those. Like and subscribe. I'll offer more, and I'll try to get some of these videos out weekly if my schedule allows. And we'll sample some more products in the future. If you'd like to see some firearms lessons as well, safety, handgun fundamentals, things like that, I would be more than happy to put videos out. So put some comments in the section, subscribe, let me know what you want to see. Thanks for watching.